The April 14th, 2026 work session of the Anne Arundel County Council is called to order. Please ensure all electronic devices are in silent mode. And I apologize that we were a little slow this morning. For those of you who come regularly, know that we are not the most prompt when it comes to work sessions. But we are ready to go now. Do any of my colleagues have any questions before we begin? Okay. I want to welcome Dr. Toni Gedden and her team from the Department of Health today. I want, for the public and for the benefit of my colleagues as well, by law, we are required as the County Council to sit as the Board of Health, but we have to do that twice a year, and we have to do it in May. And May is our busiest month when we get budget presentations and those things. So this year we have decided to have our presentation now in April, when we have more time and bandwidth to listen. We will not be asking any questions today. We will save that for in May when we sit as the Board of Health, but this will give us all time to digest and look into everything you'll be presenting today. So hopefully we will be more informed and on point when we come to you as Board of Health in May. So thank you all for coming out today. And Dr. Gedden.
Great. Good morning. We're going to jump right in and get started. First, I'd like to acknowledge all of my colleagues from the Department of Health that are here with me at the table. We have Dr. Tope Bada and Ms. Sean Kane. In addition, in the room, we have our partners with the Mental Health Agency, Adrian Michler, who's their Executive Director, and we also have all of the wonderful directors from the Department of Health, Megan Pringle, Donna Perkins, Don Curtian, Karen Siska Creel, Jennifer Snyder, Peggy Cruz. I'll get them all, don't worry. Courtney, who's acting as our finance director, and we really appreciate her. And who else? Sandy, thank you. Sandy O'Neill, who's our director of behavioral health. I think we got everybody. And they are instrumental in putting together these presentations. While I'm the one that's speaking, it is a group project. They spend weeks putting this together for you all. They really spend a lot of time thinking about what is new that we need to present to you all, or what have we seen that's changing, what are trends based on either the time of year or just what we're seeing that's happening broadly in the county. And so I want to thank them as well as their staff, because their staff are also really instrumental in putting these presentations together for us twice a year. And it is definitely a group effort. So an overview of our department, just a little bit about us, about 845 employees currently, 933 budgeted positions. Here are the locations that we are operating out of, some of which are solely health department buildings and others that we share with other spaces. And I'd also like to acknowledge that we're in all of the Anne Arundel County Public Schools. Okay, so we are going to be venturing into a new strategic plan this year. We had a strategic plan from 2023 to 2025 that focused on these 4 key areas. And just as a reminder, we were putting that plan together following the pandemic. And so reinvigorating our workforce, who had really been put through the ringer, enhancing our infrastructure, much of which we found during the pandemic. It highlighted some of the holes that we were needing to fill, deepening and expanding our partnerships, and advancing health and health equity. And so these are the things that we've focused on. We've been really excited to see some of the progress in your folders. There is a progress report that gives you, here's what we were able to do in 2023 through 2025. And as we work on our strategic plan this year, we will certainly be reaching out to the council to ask you about your priorities, what you think the health department should be working on, as this is both an internal to the department plan, but also one for the public, right? Understanding what we should be doing differently with our work. Just a little bit on our budget to make sure that folks understand how we are funded. So about 60% of our budget, a little over 60%, are county general funds. There's also core funding that is mandated from the state. Core funding is also funding that has to be matched by the county, so a portion of those general funds that the county submits are required in statute. We also have about $25 million worth of grants. Those grants are a mix of state and federal funds. Most of the federal funds are passed through through the state. They're not direct to the department, but they are a large working part of our budget. Opioid abatement funds, and we have a really small amount of video lottery funds that were specific to gun violence this year, and we will likely not have that funding moving forward. It's going to be put into a different bucket. And then, just so you know, there's a little bit on our grant breakdown if you want to know what's coming directly from the state and the federal pass-throughs, as this year's federal grants have been of particular interest, understanding how much that work or those funds are supporting our work and what happens when they stop, start, or if we get notices to immediately stop using those funds. So those are some of the funds that have been in that bucket this year. All right, so I'm going to jump right into things that are new in the health department since we last met. And what this program we did speak to you all about in October, but we've now named it and we've got more details around it. So Supporting Overdose Loss Survivors is a program specifically aimed at supporting children and families who have lost a parent or guardian to opioid overdose. And this idea is really multifaceted. One piece of this is making sure that as we're doing things like working on prevention and funding recovery with the opioid restitution funds, that we're not leaving out those who have also suffered the ultimate loss. And we wanted to make sure that we were doing something to support those families, and particularly children, because we know for any child that's lost a parent, the harm is really not something that we can measure, and there's not enough money, honestly, to then make up for that loss, but making sure that we have some funds to help support those families, to support things they may need to do. And so what we're going to be doing is really looking at children, both the parent who has passed due to an opioid overdose and the family need to live in Anne Arundel County to qualify, but looking at, based on the number of children, the amount of money would vary. So you're starting at about $5,000 for a family with one child, and about $2,500 additional dollars for every child subsequent with those. And we've been working really diligently with our partner agencies, Department of Social Services, Department of Aging and Disabilities, the school system, the Partnership for Children, Youth, and Families, to think about how this work is already being done in different ways throughout the county. How do we identify these families? How do we help them navigate? And so it's also more than just providing that financial support. It gives us an opportunity to help them navigate different resources within the county, to introduce the families to things that they can access. We've been in contact with folks like hospice. We've been in contact with banks and other institutions to make sure, as we're putting this together, that we have we're creating the easiest way for families to actually access these funds, and really thinking about things like, how do you give this to a family and not impact benefits, right? If you're someone who's receiving certain benefits, we don't want this to, as much as we can anyway, to impact your eligibility for those benefits, because this is one-time money. This is not something that's going to continue. So thinking through those things and making sure that we're talking with our partners as well as the county executive's office about how to really put this together. The other piece that we're looking at is post-secondary scholarships for those who may no longer be a minor child, but same thing. If you've lost your parent in the last 2 years, maybe you're 18 or 19 and you're ready to go to school. Again, we know that family support and that financial support is really key. So we've been working with the Anne Arundel County Community College to think of ways to actually provide support for those individuals to have a scholarship and be able to go to school. This is a pilot, to be perfectly honest with you all. There's not a lot of models for this in the country. Right now, Boston is the only place that's doing something similar, where they're using these funds specifically for families, and they are going about it in a slightly different way. But there are lots of models for funding victims of different accidents or settlements, and so we're using things like the Key Bridge, 9/11 funds to really understand how these funds can be used, what are different ways, and what are the things that families are most in need of that we can connect them with. And so we hope that this summer we'll be launching this sometime in July. but really having a lot of very early conversations to make sure that people know about it and that we understand how to get this out, because this is not something I think most families will come looking for, right? We'll have to figure out ways to introduce it to folks who have suffered this loss, and really figuring out what they need and how we can best support them. Okay, so vaccines. They're still what's new, even though many of them are not new. So how vaccines are being administered in the state of Maryland. If I'm sure many of you have been keeping up with the legislation this year, the Maryland Vax Act did pass. And so that changes how vaccines in the state of Maryland are both approved, administered, many different things. So the Secretary of Health will now have the authority to set forth independent state level recommendations. And those are things that local health departments would be following. The way that those recommendations are put together, it does require whoever is the Secretary of Health to follow other professional organizations like the American Academy of Pediatrics, American Academy of Family Providers, those sorts of institutions, and federal institutions as well. So making sure that when there are good guidelines out there, that it's not just solely up to that Secretary of Health to make those determinations, that they are following the science and the recommendations of additional groups. This also maintains the 17 standard vaccination schedule for children, and it continues to recommend things like COVID and flu vaccines for those who are over 6 months of age. And so we will continue to closely follow this. We'll make sure that we are including the public and letting them know what is happening in the state of Maryland, what they have access to, but just wanted to let everyone know exactly kind of where we are from a vaccine recommendation standpoint in the state of Maryland and the changes that have just recently made their way through. Another bill that actually, since we submitted this to you all last week, has passed, and this is the On-Farm Food Service Bill. And the difference for this bill and what's currently happening, when we have non-licensed food vendors that want to, let's say you're having an event at a farm, for instance, but they're not a restaurant, they're not a licensed food truck, you have to get an event permit, and they have to get an event permit every single time that happens. This allows for an annual food service license with a maximum of $100 for folks. So it creates a new licensure type. So there are still singular event permits. There's still the food licenses that we give out to food trucks and restaurants, but this adds another option for other types of vendors. Now, what has to happen next is a lot of regulatory language has to be drafted to make sure that that's still being done safely. And so while this piece of the legislation has passed, we imagine there's a decent amount of work ahead of the Maryland Department of Health and the Maryland Department of Environment to make sure that things like safe food preparation, potable water, wastewater management, outdoor cooking standards, and the use of farm structures, for instance, if there's an actual barn with an animal in it, are you cooking inside of that barn? Those are the types of things that we've seen or had people ask about. These are the things that our environmental health staff would be working with these farms on making sure that they're doing safely. And so while the bill has passed, there's still a lot of work to do and much more for us to come and share with you in the future about the actual regulations as they're drafted. Okay, still thinking about vaccines in Maryland. We've launched in January a Maryland vaccine program. And this program is for uninsured and underinsured adults over the age of 19. Many of you are familiar with the Vaccines for Children's program, which is a federal program to provide vaccines for children who are uninsured or underinsured. This is making vaccines more readily available to adults who may not be able to afford them. And there's a really wonderful list of almost everything you can think of that the Maryland Department of Health has now made available to local health departments. And so at our Glen Burnie, Magathie, and Parole Health Centers, in January, we started providing additional vaccines to adults. So things like shingles, pneumococcal vaccines, RSV vaccines, things that we could not give to adults before, honestly, because of the cost. These vaccines are very expensive. And we're able to do that now. And so we've had both appointments and walk-ins for people, and we continue to think of ways to inform the public of the fact that these exist, but also in partnership with our local federally qualified health centers who are referring people into the program and making sure that they're getting these vaccines. So we'll continue to come back to you all with more information on how this is going, but being able to vaccinate 82 adults that we would not have been able to provide vaccines to before, we think is a wonderful thing, and we'll continue to do this and work in close partnership with the state to learn how it's working in other jurisdictions, what their successes are, and how we can model some of that here in Anne Arundel County. We have spoken at length about Medicaid changes that are coming, so we wanted to come back to you all and really tell you what it is that we're planning, right? When I was here previously, I talked a lot about what the different types of changes from the One Big Beautiful Bill actually meant for Medicaid and how that would be implemented. Now we're looking at how do we prepare both staffing, the public, and our facilities to be ready for the increase of folks that we plan to see. And so earlier this year, actually came in front of this group before, looking for some of the federal disaster recovery funds that the county executive's office had made available to departments, knowing that we would be in need of preparation for this. And so there's a few different things that we're doing. We're looking to hire 5 additional staff members. The projections from the state is that right now across the state for every eligibility enrollment specialist, and they all work in local health departments in the state, they see about 111 people per month. Their projection is that that will go up to 200. And right now there is no money in the state budget for staffing. The state, and we do support the state moving forward with technology changes to make sure that if there are really efficient ways to leverage state systems and information to do this work, we absolutely want to see that happening. But those systems have yet to be rolled out, and they're actually in development right now. And we know that even with those changes, they still anticipate about 200 people per eligibility enrollment specialist. And so we want to make sure that people in Anne Arundel County are not facing really long wait times. Those wait times would lead to people losing their insurance coverage or potentially facing uncompensated medical costs, and we don't want that happening. So we're actively recruiting for those staff members now. We want to make sure that they are trained and in place when these changes start. That also means that we've had to do some really slight renovations on things like cubicles, setting up enough front desk space. So those things are happening. We'll be expanding our hours. Those additional staff members will allow us to fully operate both in Glen Burnie and here in Annapolis 5 days a week. Right now, staff go back and forth. We're in Annapolis 5 days a week, but in Glen Burnie, there are more limited days. So Glen Burnie will now be fully operational 5 days a week for people as well. And we think that the big impact that we spoke about previously is about 24,000 individuals who now face both a work requirement and biannual or semi-annual renewals. And so those individuals are the first that we'll really be focusing on, how to make sure that they understand the new requirements, but also knowing that we will have to see those 24,000 people twice a year instead of once a year. And we will have a lot more paperwork when they come in, and we have yet to receive any guidance on what that paperwork has to include, what the work requirements will look like. And so as that information comes out from CMS to the state, we will be sure to share it with you. More on what we're doing with Medicaid. So we talked about adding staff, and we talked about making sure that we had space within our offices to do this work. But one of the other really big pieces of this is the communication and making sure that we are appropriately campaigning to folks so that they know what is going on, what they need to do, and thinking about all of the different ways to reach various populations that are impacted. While we know that working adults between the age of 19 and 65 are one of the groups that we'll be focusing on the most, there are changes that go across all populations, like retroactive coverage, right? We want everyone to understand that retroactive coverage timeframes have changed and that they are appropriately coming into the office or filling out their paperwork as needed. And so here's just a couple of the ways that we're thinking about doing this. The Maryland Department of Health is also really heavily working on communication strategies, but we know that they're strategies and campaigns will be state level. And so we're thinking about what are the ways to connect, who are the trusted voices in Anne Arundel County to get out in front of folks, who are the partners we should be working with, the organizations we should be working with to get this message in front of people. And so thinking about presentations, support events, targeted outreach to make sure that people know in advance. For a lot of these individuals, we know who they are, we have their information. How are we reaching out to them? One of the things that is really waiting on to before we start the targeted outreach to specific individuals is there are exceptions to these rules. So you may have a certain disability or a disease state that may make you an exception, and we don't want to tell people, hey, this is what's happening, and then find out that your exception actually will exempt you from some of this. And so we're waiting for the state to give us a bit more information on what those exemptions will look like. But a lot of this other information that's more broadly, more broad campaigning, we will be able to start much sooner and plan to launch this summer. Another new thing coming into the department, there's a federal earmark for gun violence intervention work. And this funding is $1 million across 2 years. So essentially for us, we're looking at $500,000 for the next 2 years, designated for Northern Anne Arundel County. So when the earmark application was put in some time ago by the county executive's office, we looked at where the data was showing us that we needed to do more around gun violence. And as you all know, we've been focusing in Annapolis. We've got some work happening in West County, but North County still had really high levels of gun violence that we wanted to make sure we were addressing. And so not dissimilar to the other rollouts and launches of the violence interruption programs we've had in other parts of the county, we'll be looking for a community-based organization to run this work. We'll be looking for community-based organizations who have really close ties to the community that's selected, that has the fiscal ability to manage those funds, and the credibility in those communities. And so we did, back in September of 2024, Cure Violence Global did come out and do an assessment in the Glen Burnie area as well as Brooklyn Park. And we will be working in one of those two areas. It will only be one of the two, but working in one of those two areas to make sure that we are implementing a new violence interruption site using the current evidence-based model that we have. And so if you have any questions, please let us know. This is going to be slightly different. Obviously, the funding source is different than general funds. So as we're learning more about how these funds will be rolled out by the DOJ, we will certainly come and share with you. Right now, we're kind of waiting for the webinar to launch the kickoff so we understand the timelines of when the funding is actually dropping, what our actual 2-year timeline looks like. So there's still some unanswered questions about the time frame for this, but we have started the internal work to be ready for when the clock starts ticking for us to spin this. So we're prepared, and I think we're ready to move this forward, but it will be a significant lift, but one that we are excited to have the opportunity to work on. Hey, what else is new? We are currently in Black Maternal Health Week. It is a national week that's recognized between April 11th and April 17th of every year. And we've talked in this group more than once about the disparities that we see in birth outcomes. And we wanted this year to highlight it for the county in a tangible way. And so we've partnered with our library system to have the posters that you see, and there's actually multiple versions of the one on the right with the actual family members. These are Anne Arundel County residents. But one of the posters really highlights the disparities that we see and some of the drivers of those disparities. The other poster is a reflection of our Community Advisory Council. So we have a group of women in the county who have really decided to help us, quite frankly, right? If they give their time, they give their ideas, they give us their feedback on how we can improve these outcomes in Anne Arundel County. And so the theme for this year is rooted in joy and justice. And so we asked the members of that council, what does that mean to you? As folks who have decided to engage in this council, they are all mothers, and so we asked them what it means. And so what you'll see here is this particular member decided to say why she advocates for Black maternal and infant health and the joys that she is having and motherhood. And so you will find some variation of this poster. Some of them decided to write poems, others told different stories, and we think it's really powerful to actually attach the lived experience to the data. The data is interesting and it is important and it is disturbing, but it's also important to talk about the people who are actually living this in Anne Arundel County. And so I really want to thank the community advisory councils for being willing to put their feelings, their thoughts, and their families. This particular member decided on this picture. Others they all have pictures of their children and their families as a part of this. So those posters are on display both in the libraries and in health department buildings. We're also, Dr. Bada and I are participating in the National Coalition of 100 Black Women. They have a presentation that they do to their membership this Wednesday. We'll be presenting at that. We also will highlight it during our Health Equity Forum and just thinking of different ways to make sure that we are raising the awareness of this issue, but also working with our Maternal and Infant Health Task Force, which includes our hospitals, pediatricians, DSS, doulas, many folks working in the birthing space to highlight this, but also to actually work on tangible changes within the healthcare system to see differences in these health outcomes. Okay, so something else that's happening new, and we've had some conversations here previously about cancer rates throughout the county, where we're seeing different types of cancer, which populations are being impacted. And so there's a new cancer data dashboard that really outlines both risk factors for cancer, protective factors, and then if you're looking to understand what types of cancers people are experiencing, at what age, what might be affecting men differently than women, those sorts of things will be available on this dashboard. And so just wanted to make you all aware. As usual, there's always a lag in the data that we have, particularly as we're getting it through the state and other vital records, et cetera. But we think it's still really critical information to understand, and we want the public to understand what we're seeing and how they can improve their chances of both, if they are diagnosed with cancer, surviving that and getting diagnosed early, but also what are the preventive measures that they can take to hopefully stop a cancer diagnosis if possible.
Madam Chair,
All right, so that.
can I ask her before, where she's on this last slide?
Yes.
Or,
Quick question.
just quick, do you have a, where those people are located as well? Because I often get sometimes community input about cancer clusters, and it'll be nice to see like a chart that highlights this data on the female male. I know we have the age, numbers, ethnicity, but where in the county are these individuals are living?
Yeah,
so just from a data standpoint. That's
absolutely.
all. Thank you.
Yeah, we do have some of that information. It depends on the type of data. So when we're looking at deaths specifically, sometimes we can't provide that information. Let's say in a particular zip code, there are 5 deaths. It potentially is identifiable then. And so it really just depends on the amount of data that we have, which area it's in, but we will definitely provide more of that information. But that's really the overview of what's new. And then we want to get into some of the programs and services and really highlighting each of our bureaus as well as our Office of Assessment and Planning. Healthy Anne Arundel Coalition. We've just passed Healthy Anne Arundel Day, which aligns with World Health Day, and this is a really great opportunity for our local health improvement coalition to work with both businesses, nonprofits, and other county agencies on a healthy food drive and hosting events throughout the county. So if you're really interested in more of what they've been able to do, there's a link within the presentation, but it's wonderful every year to see how many folks are willing to give up their time, of their business to support this. And so we really want to thank all of our partners as well as everyone who works on the local health improvement coalition, Healthy Anne Arundel, to make sure that this is happening. So other things coming up, May will be Mental Health Awareness Month. We'll definitely talk more about that when we're here next month, but the Mental Health Agency and AACPS will be hosting events to raise awareness. The Mental Health Agency also has their Family Fun Day, which is a wonderful event that's really geared towards families and heavily attended, and they provide a lot of wonderful resources there and have lots of events that day. And then in October, participating in Walktober. And so when we were here previously, we told you about Walktober and what that means and what we're doing in that space. I'm so excited to see the Healthy Anne Arundel Coalition really continuing to lead these events to bring together various partners in the county. One of the other things that we use quite a bit in Healthy Anne Arundel is Find Help. And we've talked to you all about what that app looks like, what we're collecting. But what we continue to see is that people are searching for health resources, they're searching for housing, and they're searching for food when they're using this website. And so we've seen almost 7,000 searches for services in calendar year 2025 and almost 3,000 distinct visitors. And we use this platform not only within the health department and Healthy Anne Arundel Coalition, but also we've had other partners really start to take hold and use this. So the community health ambassadors are using it, but we've had other healthcare partners embedded in their electronic health records, so they're able to help people navigate for resources when they need them. But we want to make sure that we are being responsive to what the community is looking for and what they need. And so these are things that we will continue to work on, but really helpful to understand when people are out and they're not interfacing with us, what is it that folks are searching for? And dental care is also one of the top searches. And as a dental provider in the county, we understand the level of need and the expense associated with that. Okay, our Health Equity and Racial Justice Office continues to connect with folks. There's a couple pictures here on some of the wonderful work they've been able to do in the last year, but there are other things that we're up to, as well as hosting events and supporting events. We've had about 33 different community events. We hold a Health Equity Forum once a month, and that Health Equity Forum is not only for the health department to share information about various health topics, it's also a way for us to spotlight community organizations that are doing work and introduce people to one another. So if you all know of organizations that are doing great work, that are looking for a way to share what they're doing and they need to get it out to others, this is an excellent forum. It is one of the only forums that we have that's both open to the public and to other members of the community. And we have an excellent turnout every month. It's really continued to be one of the forums that we use in a variety of ways in getting information back. So when we're presenting things, the questions that we get, the feedback that we get is really valuable to the health department. And so we want to continue to make sure that we're having topics that matter to folks. So we've done things like vaccination, cancer presentations, sickle cell awareness. We had a partnership with Howard University to do sickle cell testing at our health centers, swim safety, when we know that this time of year is coming up. So working with rec and parks to make sure that folks understand what the services are to help children. And then we also make sure that we're providing information like these Medicaid changes, the SNAP changes, having a transportation showcase so people understand how to get from point A to point B and what the resources are in the county. And so this is just a little bit about what they've been able to do. There are forums upcoming. As we mentioned, May is Mental Health Month, June is Gun Violence Prevention, and Black Maternal Health. These are things that we are highlighting at those forums. So we really encourage folks to join us. You can join both in person and virtually. Our community health ambassadors are really wonderful partners. They do such great work throughout the community, and it's been wonderful to watch them grow and blossom and share information back with us. And now I think, as opposed to just being the health department, kind of giving health information to them to further their ability to go out and have these conversations and impact the public, we're probably learning as much from them as they are from us at this point. So here's just a little bit on what they've been able to do, but our focus on mental health first aid has been really, really crucial. And now many of those organizations are mental health first aid trainers. So not only are they able to talk to people about it, they're able to train community members in mental health first aid, continuing that. And it's one of the things that I think is also really critical is that they're able to offer it in different languages. So My Life Foundation is able to do it in Korean. We have more than one organization that's able to do it in Spanish. And so making sure that we're getting out to the community in many different communities is going to be something that we want to continue. We're also working on cancer health ambassador training so that folks understand when to refer folks for breast cancer, prostate, colorectal, and lung cancer. We have programs within the health department. Our breast and cervical cancer screening program actually is more than breast and cervical cancer. And so we want to make sure that people know what are the signs and symptoms of those cancers, what are the screening protocols for those cancers, and how can they refer people to us, or making sure that they're at the appropriate ages or with the appropriate symptoms or family histories are going to talk to their providers about how to engage in those screenings. I'm going to do a quick rundown on some of the data points that we are commonly sharing with you all, which is leading causes of death. We've talked a bit about cancer in our presentation today, and one of the reasons that that's a continual focus for us is because it is the leading cause of death in Anne Arundel County, followed by heart disease, accidents. You all will see, here's just a little bit on the leading causes of death and some of what we're able to do in those areas you'll hear throughout this presentation. As we are hopefully very soon wrapping up cold and flu season, we wanted to make sure that we come and share with you what the respiratory illness data looked like for 2025 and 2026 currently. And so LIL is, or ILI is, influenza-like illness. And as folks are presenting to both ERs and urgent care, we want you all to understand what that looks like throughout the weeks and what we're doing as a result. Here's a little bit more on that in that same space. What do we see happening comparing seasons? This season, I don't know that we saw anything that was particularly out of the norm for previous seasons. We continue to keep our eyes peeled, but so far I think we're pretty much seeing what we expect to see this time of year and given the current vaccination rates. Hospitalizations, again, we present this information because this is when those illnesses get critical. If you're being hospitalized for influenza, RSV, oftentimes those hospitalizations are also pneumonia. It may have started as the virus, and then people end up subsequently with pneumonia. And we want to make sure that this is why we really promote vaccinations, because vaccinations prevent hospitalizations and deaths. It may or may not change the curve all the time on the numbers that you're seeing, but we do absolutely see a correlation between hospitalizations and deaths. And so these are the numbers for 2025. We've had about 116 influenza hospitalizations in a particular period in December. We see this every year about that time after the holiday season, right before the new year. As people have gathered together, this is when we tend to see our peak, and that is not dissimilar to previous years. A little more on our vaccination data and what we're seeing this year. Across the board, slightly down from last year. And we still see more folks taking the influenza vaccine than we're having an uptick of COVID vaccines, but both are still available. And as I mentioned, and we've talked about in October, the recommendations changing from the federal government. We've answered a lot of questions about that this year, and we hope that next year, with the Maryland Vax Act, that we're able to get ahead of that a little bit more and maybe lessen some of the confusion that folks have about what the recommendations are and the conversations that they should be having with their providers. Overdose data. This is one that we also track really closely and have continued to see wonderful progress throughout the county. This is a change that we're seeing both in the state and nationally. We hope that it will continue. But this is what we're seeing for non-fatal and fatal overdoses in the county. And we've tracked this back to 2019. At the previous meeting, there was a question around when did tracking actually start for opioid overdoses? And at one point, when tracking started in 2016, 2017, we weren't tracking both non-fatal and fatal. And so we are presenting this data when we started to track both of those things. Again, what we're looking at, fentanyl is still the leading cause of death in opioid overdoses, about 82% of those. There is a time lag for this data sometimes as we were waiting on the OCME's office to present this information or for us to get it, but cocaine is the next leading cause of overdose in 2025, and about 1 in 6 of those individuals also have alcohol in their systems at the time of death. And so what we know for sure is that there are multiple factors, and many individuals have more than one substance in their system at the time of death. And so what we are working on in these cases is making sure that we're getting as much Narcan as possible, naloxone out to people, that we have things like fentanyl test strips and xylazine test strips so people know what they are ingesting, and have the ability to make some different choices. And we will continue to track these trends, but they are really encouraging, but it also leaves space within the health department and in our overdose prevention team to really start to talk about other substances and things. Our behavioral health director, Sandy O'Neill, often reminds me that alcohol has always been a part of what we see in substance use. It's never gone anywhere. The attention that's paid to it changes based on what else is going on and what we're seeing, particularly around fatal overdoses, but it is as critical that we pay attention and devote some of our resources to various substance use types for different people. Our cold weather related hospitalizations, as I guess we're out of cold weather, maybe we'll cross our fingers and hope that this week is actually the turning point. But we do continue to see, unfortunately, increased emergency room visits around weather-related illnesses. And it's really unfortunate because these tend to be highly preventable, right? Making sure that those warming centers are open, that individuals know how to access them, that people have appropriate heat in their homes. These are the things that would stop a lot of these illnesses. And for the state of Maryland, as of April 28th, there were 64 cold-related deaths in the season, and 5 of those deaths occurred in Anne Arundel County. And so we continue to think of additional ways to support our partners in the warming centers, sharing that information out with individuals, but also the signs and symptoms of cold-related illnesses so people know when it's getting dangerously cold and what to do. And as we continue to see fluctuations in temperatures and winters like we had this year, where we had some really, really cold days, this is something we'll need to pay even more attention to as we see those temperatures changing and dropping. Gun deaths, homicides, and suicides. And continuing to see this year some positive changes in our suicides, and about 35% decrease from this time, from 2024 to 2025 in the same time period. And same thing for our homicides. We're continuing to see what we think is hopefully when we see one death compared to one, is hard to say that it's a true increase. It's one more, and one life is always too many, but we're seeing kind of sustained changes here. Gun-related homicides are similar to 2025, but we want to make sure that we see some more changes. And hopefully in things like violence interruption programs and education, we can see that change coming to light. A little bit on our behavioral health work. We've talked about, we looked through the overdose data a moment ago, but wanted to highlight some particular percentages for you all and to talk about what the strategic goals are for the overdose prevention team. Every jurisdiction in Maryland is required to have an overdose prevention team, and it's chaired by each jurisdiction's health officer and another member. For us, it's both our OEM offices for the city of Annapolis as well as the county. And what are we working on? So prevention, harm reduction, treatment, recovery, public safety, and data are the ways that we organize our work, but thinking of ways to talk about how do we improve each of these areas? How are we using opioid restitution and abatement funds to further these causes? And how are we interrupting pathways to substance use disorders? These are critical, and we're working on the strategic planning right now for all of this to make sure that we are using our data to drive us and also lived experience. We also have a Harm Reduction Advisory Committee, which is made up of individuals with both lived experience and people who work in the space. And we think that's really important to understanding how interventions will be received and perceived in communities, right? Those things are important. And so not only looking at what we think we should be doing, but really, gut checking that with the community and folks on the ground to say, what do you think about this? Or what do you think we should be doing? And so working with those commissions and those committees is equally as important to our successes using the data to drive those changes. But here's just a few recent success measures that we've been able to take a look at. Again, we're seeing overwhelming decreases across the board in our overdose metrics, and we really hope to see that continue. A little bit on our Health to Go vending machines. This is something we've been talking about for the better part of the last 2 to 3 years. There's just some data on what we're able to give out in those machines, what people are actually using, and where they're located. So we've been able to expand. There are now 13 machines available throughout the county. The locations are listed here, and we are currently in conversations with our Department of Social Services partners about having a machine in the front of their lobbies. And they had seen the machines and saw them and said, is this something we can do? We think this would be important for the folks who are coming through the DSS offices. And so hopefully very soon we'll actually see those there as well. But there's a list of what's in the machines and what people have been taking out of them. And this is, they are free of cost to the individuals who are at the machines. Suicide prevention. We are continuing to look for ways to bolster our work in this space. This is critically important, but this gives you just a small snapshot of some of the things that we've been able to do. And in your folders, there's also an invitation to our Suicide Prevention Summit that's being held once a year. And that's now, I think this is the 3rd year we've been able to do that. We get a wonderful turnout. It's a great collection of professionals in the behavioral health space, as well as other community members who work alongside them or work in different spaces where they're coming into contact with individuals who are being treated or in need of mental health services. And so they have both a community coalition who's supporting this work. So there's a suicide prevention coalition that's working here. Things like our firearm retailer compliance, where we're giving out the literature on suicide prevention. Those compliance checks, there's a little bit of information there for you all on what we're seeing and how many times we've been out to gun retailers, but also working through mental health first aid training, community support training, question, persuade, and refer training. These are things that we want to make sure that the community has access to broadly, but also free of cost. And so we continue to make sure that we're providing these in different places and finding ways to expand our reach. And right now, I think our probably biggest limitation is the number of staff that we have working specifically in this space, but this is something that's also not just the health department. This is where our partners at the Mental Health Agency are critically important to this work and are doing so many things in this space as well. So we are grateful for their partnership in this work as the local behavioral health authority as well. Oh, right, there we go. The Mental Health Agency, we're going to get into a little bit about what they've been up to. This is one that we bring to you all every year because I think folks really want to know the numbers, right? How many people are calling the warm line? It's operational 24/7. So they're looking at a little under 30,000 calls, unduplicated services to almost 8,000 individuals, stabilization services, program assessments, so what we're able to do in that space, and individuals who have been diverted from hospitalization, jail, or court is also a really incredible part of the work that they're doing at the Mental Health Agency. A little bit about what they're doing to get out into the community. As we mentioned, what we are doing in the health department is not the only space for this. And so they are very active at outreach events and festivals. It's that time of year, so we expect to see them at a number of different places. They do mental health first aid training as well, applied suicide skill intervention training, older adult and crisis intervention, as well as education, continuing education for mental health professionals is really important. And the crisis intervention team, they are providing, have received training and refresher training for 53 of the individuals that work in that space. And contracts for services. So they monitor 47 human services contracts and MOUs with various programs along the spectrum. And this is really important to make sure that people within Anne Arundel County are actually receiving quality care. This work means that if there's something happening, and we do a lot of this in partnership as the LBHA, but understanding if there are complaints about a particular organization, how are we going out and investigating that? How are we working with providers? They have a monthly provider meeting to allow for resource sharing, conversations. That meeting is attended by both Sandy O'Neill, Dr. Bada, and Adrian. And they're all there to provide support for community providers and answer questions, give them information. I think it's really one of the best ways to welcome new providers into the county, but also make sure that folks who have been here for a while understand that resources change, understand the trends that we're seeing, and that we understand what they're providing within their organization. Okay, disease prevention and management. I wanted to share a little bit about measles and mumps because they've been in the news a lot more frequently, and depending on what you may or may not have seen in your own personal life, we do know that a number of parents don't necessarily recognize these disease states right away because they have not been very common for quite some time. And so as we see it happening more, we want to make sure that you all know what we're seeing in Maryland, what's happening kind of nationally, and what are we doing to protect. So the MMR vaccine is for measles, mumps, and rubella. Those vaccines are readily available to adults and children in the county. But what we've seen in the state, in the country this year is a little over 2,000 confirmed measles cases. And that's, it's concerning because measles is heavily contagious. One person can infect lots of people really rapidly. And so understanding what it means for unvaccinated close contacts, what that means for school-age children who may be unvaccinated, and the work that we do around contact tracing is important. And so far, as far as March 5th, this year, we've had 1,200 cases in the country so far, and we know that those numbers are higher than what we've seen in previous years. It's not that we have not seen measles and mumps cases, it's that the numbers are going up. And so we want to continue to watch these. We want folks to understand what it looks like if you or a family member may be presenting with one of these disease states, and that they can come to the health department if they have questions, but more importantly can come to us for vaccinations if they have not done so. And what else are we up to with disease prevention and management? Our Healthy Communities program is one that spurred out of the pandemic and our ability to get out into the community and provide vaccinations in different ways outside of our health center walls. And so we've continued to do that. About 61% of our vaccine doses to children, including flu shots, were provided directly in Title I community schools. That's a wonderful partnership that we have with ACPS as well as our school health staff in helping to make sure that we're identifying children who need these vaccines, but we've been able to give almost 9,000 vaccines in the county this year. Also still distributing things like masks for individuals, right? Masks for people who are high risk, people who have high risk family members, people who are actively sick. These are things that are still recommended. COVID test kits continue to be, especially during cold and flu season, one of the most popular items in our health to go vending machines, and we think that's important to make sure that people are able to stop the spread. If you know that you are you have one of these conditions, and we do have some COVID and flu kits, but mostly COVID kits, it's important that folks are taking the appropriate precautions to protect themselves and others around them. But also other infectious diseases, hepatitis C, HIV, syphilis, being able to do rapid tests for those things so people can get information on the spot about their health is important. So we've been able to test 773 people in that space, providing comprehensive case management to over 200 individuals with HIV, integrating newly diagnosed individuals immediately into care And so what does that mean? That means if you get a new diagnosis, which while HIV is really treated these days as a chronic disease, it is still a really devastating diagnosis and life-changing for people. And so making sure that people are immediately connecting with care is important, and this team does a wonderful job with a 90% adherence rate to people who are newly diagnosed. Our EPI team has been able to manage 96 different outbreaks and investigate over 1,400 disease cases across the county and handling rabies exposures. And this is one of those spaces when we come to this council and talk about what we're doing for rabies. It's both what we're doing in environmental health and trying to prevent it on the animal side, but it's also what we're doing with humans to make sure that we are appropriately giving them the resources that they need, providing post-exposure treatments, and ensuring that they understand how to prevent further exposures. And our tuberculosis team is working really hard at making sure that latent TB infections folks are adherent to their medication, and that we're actively managing people with TB and doing a lot of directly observed therapy in the community. We spoke about cancer screenings, but wanted to share a little bit more with you. We were able to provide almost 1,000 breast and cervical cancer screenings, and out of that, 10 early diagnoses. So these are the resources that we want people to come to the health department if you're not connected to primary care, or if you don't have insurance, or you're underinsured. We are a place to come and get these things, get these screenings that you need, and then get connected to services and get case management that you need to help people walk through the process. These diagnoses are devastating for people. So having someone to walk you through the process, healthcare entities are not always easy to understand, and so making sure that we're working with people so that they know what it means to have an early diagnosis, what the next steps in treatment look like. And that's what that team is able to provide. Community education around cancer and tobacco prevention, tobacco enforcement in partnership with our police departments to make sure that retailers are not selling tobacco products to underage individuals, and still working with Healthy Food Access, providing 34 tons of food through the Brooklyn Park Food Pantry. Environmental health. There's always a lot going on in food protection, and I really want to highlight this team because they work incredibly hard, and hiring individuals into this particular field can sometimes be a challenge, and so the folks that we have are always working really hard because we are constantly recruiting for more inspectors to do this work. But they've been able to do 2,600 inspections this year for our 3,100 licensed food facilities. Their routine inspections were about 1,500 of those, and those are things that we are mandated to do. What we see happening right now, which is been a long time coming, and it's the picture at the bottom right, is the ability to apply for these renewals online. And right now they're actively working to set this up so new food licenses and facilities can also do this work online. It's important because I think it's creating faster and easier ways for people to do this work. It's less of a barrier for business owners, and we hope that that will continue. Our oral rabies vaccine program, we were actually just meeting to talk about this yesterday. So we found that October is really the sweet spot for this, and I learned so much from this team. I could not have told you before I took this job when raccoon babies were born, but now I know. And what we know is that by vaccinating in October, the young are actually strong enough to compete with the adults to actually eat some of the vaccines. So we've seen our highest conversion rate at 53% this year because we've been able to put these vaccines out in October, and we think the younger raccoons are actually eating more of the vaccine, and then we have a higher conversion rate. So we will start this program again in October of this year. As you all know, we do a lot of communicating to the public so that they understand what's happening when they see the fish meal packets in their neighborhoods and what we're up to. And then we go back out and actually do blood draws and test the animals to make sure that we're seeing that conversion rate. And we continue to see much lower rates in Anne Arundel County Many of our partnering jurisdictions are always interested in how we do this work. And I just have to thank the county for continuing to invest in this, because I think that's where it tends to fall apart for other counties, when they realize the amount of both staff, funding, and time that it takes to operate this program is something that has to be both a commitment from the health department and the county, and that really changes what we see in Anne Arundel County as far as exposure to rabies. Our beaches programs, it's that time of year, so we're actively looking to hire individuals into this work. So we are out both monitoring and sampling public beaches, both through Memorial Day through Labor Day of each year, but also thinking about things like safety advisories. Right? When are we putting out advisories that people should not swim? Or when are we seeing things like sewage spills in waterways that we have to communicate to the public? These things are continually happening throughout the department all year long, for sewage spills in particular, but our seasonal testing is about to start. And something that people don't often understand is after really heavy periods of rain, it changes the bacteria and the chemistry that we see in the water. And so we also have a rainfall rule. After 48 hours of following heavy rainfall, we don't recommend that folks are in our publicly sampled beaches, but trying to make sure that people understand that and why that is. So some of the things that you'll see throughout the community are signage in impacted areas, social media notifications, press releases, and depending on the size of the spill, if it is an actual sewage spill, we do have to do more notifications. So the bigger the spill, the more communication that you will see, and the greater amount of effort that we are required to put into making sure that people understand these safety hazards. Rodent control is a constant favorite of you all. I know that you get a lot of questions about this. So just wanting people to understand which neighborhoods in 2026 we will be going into. We're going to look at new ways of understanding where we should be. So what we've seen for neighborhoods like Maryland City, for instance, we don't necessarily get a lot of complaints. And the way that we've historically decided which areas to be in has been complaint driven. As we see less complaints in an area, but we started Maryland City last year, our inspectors go out and they're like, no, the need is here, despite the fact that we're not hearing from folks. So how do we go out and assess and understand where we should be? And that's a conversation that we're currently having within the health department to make sure that we're not only addressing those who are making their voices heard and having us understand what their needs are, but those communities who may not be doing that, but still are in need of those services. So we're hiring for these individuals right now and hoping to get this work started over the summer, but there are letters for you all. Hopefully, we would like to work with you to make sure your constituents know how they can contact us, how they can make a complaint, what sort of things we have available for them, and having community meetings and mass mailings in areas that have been selected. So there's much more to come, but we really are thinking of how do we continually improve the process, and how are we making sure that we're reaching everyone that needs these services. Groundwater, so private wells and septic systems. We were able to start perk testing in the county on March 9th. That was later than we would have liked, but it's all dictated by the groundwater levels. And so the levels were not high enough until March 9th. We've started that, but we continue to have a really dry season so far. And so our staff are working on ways to do sand mound testing and other things with individuals to make sure that they're able to get the permits that they need. But we'll keep you all posted based on the rainfalls and what we're able to do in this space. This just gives you a little overview of how many properties in the county are served by private wells, how many permits were issued, disposal systems, and our BAT program, our best available technology, to make sure that we're reducing nitrogen in different areas, and also providing funding through our grants for individuals who need to change their septic systems and have found that they are no longer working appropriately. We don't want costs to be one of the barriers for individuals in making sure our groundwater is safe. Okay, our family health Services Bureau. We talked a bit about gun violence already and what we're looking to do in North County, but here's a little bit about what's already going on in both Annapolis and in West County. These are the teams and the folks that are out doing this really important work. There is in your folders, there is a report on annual report for Cure Violence Annapolis that we were able to put together showing their successes, some of the challenges they face, some of the things that we are looking at, and how we can continue to improve this work and do it differently. But so far, so good. It's not that we haven't run into roadblocks or little barriers here and there, but these teams have been incredibly receptive, and the health department is learning as we go as well. These are new programs within our department, but continuing to expand this work, and hopefully next year there will be a third site with another picture of wonderful individuals doing this work in the northern part of the county. We talked about Medicaid changes and eligibility. Wanted you all to understand what's actively happening right now, even prior to those changes. We have about 104,000 individuals in the county who are beneficiaries. We've assisted at our 2 enrollment centers a little over 7,000 individuals, almost 10,000 verifications, and this is a 4.5% increase that we've seen compared to 2025. And so we want to make sure, again, that we're staffed appropriately, that we're resourced appropriately, and that we're communicating to these individuals. There's also a flyer in both English and Spanish in your folders. We've started new prenatal support groups, and these support groups are located in 4 parts of the county: Brooklyn Park Library, the Severn Center, Harbor House, and Eastport Terrace in Annapolis, to really make sure that we're pulling residents together to support one another, to make sure that they have both education resources and access to things like mental health guidance, but also that they are creating a community amongst themselves and supporting one another. So our Healthy Start nurses and parent educators are facilitating these groups using an evidence-based curriculum, and we will come back and let you know how they are going, but these have just launched in the last month or so. School health. We are in phase 2 of the planning process for school-based health centers in Anne Arundel County. As we previously mentioned, there are currently no school-based health centers in Anne Arundel County, but there are a number throughout the state. And so our Director of School Health Services, Karen Creel, and the Deputy Director, Misha Alston, have been doing a lot of research and going out and meeting with other counties to understand how they are operating their programs. There are many different models and ways of doing this. So understanding which model is going to work best here in Anne Arundel County, understanding which model will work best starting with just one site. And many of these programs have existed for 20, 30 years or more. And so they have a lot of historic knowledge, and they have many different sites. So some of the questions that we're asking as a new site, some of the staff are like, oh, we've been doing this for a long time. So really trying to get a good understanding of who might have started this a little sooner or a little later that we can actually talk to. What did it take to stand it up? If you've been in operation for 30 years, that historic knowledge might be gone. But I really want to commend them in going out and doing this legwork to make sure that as we continue to look for how to operationalize this at Brooklyn Park Middle School, that they are doing this in a way that's both cost-effective, impactful for the community, and in good partnership with AACPS. And so they've done a lot of work in this space and are thinking through a lot of challenging questions. Phase 3 will be a bit longer. That's when we will actually get into understanding the construction needs that might be, what might be needed for AACPS, the model, and those models vary. It could be hiring individuals within the health department. It could be partnering with another healthcare organization to actually run the site. So as we look at which model fits best, we'll then come back to you all and let you know which model we've selected and how we will operationalize that moving forward. And this year we had an audit in late October, and they were on site with us in November. And here's just a little bit about what they said about our school health program. Each school health program has to be audited by both the Maryland Department of Health and the Department of Education, and they come out and they do this in partnership. And so they met with our team as well as Dr. Bedell and his team. They toured a school. They really spent the better part of a day getting to understand what and how we operate health rooms here in Anne Arundel County, and had really thoughtful insight, but also lots of positive things to say about the way this program is being operated. And so we're always open, not that we have a choice, but to these sorts of things. And we look forward to the report, right, to understanding what they can do, knowing that they're seeing these programs throughout the state. There's always something we can learn. But they noted our intentional focus on outcomes and quality improvement, and we hope to really continue that and that we could serve as a model for other jurisdictions. Something that we brought to you all before was the change in providing stock bronchodilators within schools. And what does that look like? What's been happening? So we've had 198 students receive at least one dose, 14 of them requiring a second dose. And then we're stocking these medications for children in respiratory distress or those with severe asthma whose personal inhalers may not be available. So this gives you a little bit on what's happened to those students, how many of them were able to just return to learning, how many had to go home with a guardian, and how many were sent to the hospital. But we think having these stock bronchodilators is important, right? We've had almost 200 children use them, and we think that having them in our health centers has improved our health outcomes, and knowing that about 60% of those children were able to go back to class instead of going home is a good thing. What are we seeing in our health rooms around something that was not statewide? So bronchodilators was statewide legislation. The use of acetaminophen in schools is something that we heard particularly from students when we did our needs assessment for school-based health centers, that for older students, having the access, if you have a headache or menstrual cramps, to have access to acetaminophen was important for them. And so this is done under the consent of their parents or guardians. So about a little over 1,000 families have actually signed consent forms so that their children, when they come into the health rooms, are able to access this, hopefully, again, staying in school, not needing to go home for the day because of pain that could be managed with acetaminophen. And then just a little bit more about our stock inhalers and how we are. And we've had almost 800,000 health room visits. They are incredibly busy places with all sorts of interesting stories and a really dedicated workforce. I'm meeting with 2 different clusters of schools this Friday and hearing the stories about what they're managing on site, the chronic illnesses that they're managing, the healthcare needs of children who have things like tube feeds and trachs for breathing and have diabetes and other disease states that they're really managing in those offices. It's incredible to hear how they're juggling it all, how they schedule it all throughout their day. And so I really want to commend all of our school health staff. They respond to whatever comes through that door, and they don't always know what's coming. And that is the end of our presentation. I'll turn it over to you all because I think we're not doing questions today, right? Okay.
As always, it's just amazing what all y'all do. I mean, it's incredible. Every time I think I've heard all your programs and I'm constantly amazed. I have taken lots of notes. I'm sure that my colleagues have as well. And we will look forward to questioning or digging deeper when we meet as Board of Health in May. And I do encourage my colleagues to send questions to Dr. Gedden beforehand, so they'll make sure, so we don't forget between now and then, but that everything can be addressed when we meet back together. But thank y'all so much. Greatly appreciate all you do. Thank you for everyone for coming out and sitting and listening to it too. We appreciate all your input into the information. So.
I know, right? I was like, Lord. No. And I was so fidgety the whole time I was.
Okay, thank you everyone for being patient. We are going to jump, I'm looking forward on the 20 to Bill number 2626 and Resolution 626 and Bill number 2726, which are all regarding National Business Park. Mr. Hunt.
Madam Chair, good morning. Ethan Hunt for the administration. With me, I have Lori Blair Klossmeyer, Deputy County Attorney, David Gregory and Ellie Pinto from our Bond Counsel, and Brian Schenk from our Office of Finance, our Financial Services Manager. So these two bills and resolution all relate to National Business Park North, and I can give a broad 10,000-foot overview of what they do, and then I can turn it over to the Bond Counsel to delve into the details. So basically, National Business Park North was set up as a tax increment financing district back in 2010, I believe, and they have since acquired some additional parcels. And so the resolution is adding those parcels to the TIF district. The bill is adding those parcels to the special taxing district. And the reason that there is both a special taxing district and a TIF district that are coterminous, they're the same district basically, is that the special taxing district is sort of the backstop in the event that the TIF district, if the increment that comes in to repay the bonds and service the bonds, if the increment is insufficient to meet that service, then there's a special taxing district and special taxes can be levied. This is a very well-performing TIF district, so there is no assessment on the special taxing district. And then the other bill is making some technical changes, referring back to the original bill and resolution that set up the TIF district and the special taxing district to reflect these changes.
Got it. Step one, good morning. Mr. Hunt did a really great job of describing why we're here in front of you this morning with this resolution and the ordinances which expand the original districts that were put into place in connection with the original bond issuance under the 2010 ordinance, which was resolution. As described by Mr. Hunt, the resolution established a TIF district, which is set up pursuant to a petition made under state law by the landowners. In this case, the developer, COPT, had made that application. And subsequent to that original designation and that original adoption, as Mr. Hunt described, additional acreage has been identified that should be added to the land covered by that legislation to essentially align that property description to in a way that reflects the new lot lines, which essentially occurred by virtue of the acquisition of additional acreage over a period of time by COPT. So this really enhances the overall geographical district in terms of acreage. Everything within the proposed additions is already covered by previously financed public infrastructure improvements. Utilities and whatnot are already existing as it relates to these additional parcels, acreage being added. So what would be included in the legislation reflects the incorporation of this acreage, and it will become part of the, in part, of course, in part will be part of the coverage for the bonds that were issued to finance this in terms of the availability of TIF increment to be paid to support those previously issued bonds. So I'm going to pause there and allow others here with me to add on or to correct anything I may have said there, but I believe that provides a reasonable summary of what we're doing today.
So the COPT is, all of this belongs to COPT? This is all part of the same?
Correct.
Okay.
Correct, and I can confirm COPT owned all of the land that was in the previous boundaries, and they owned the new add-in land, so it's kind of just, the amendments are just to align the new map with the old legislation and bring everything up to date. They're both coterminous.
And you stated that this is also a special taxing district, but currently there's not a special tax because the TIF is enough to cover the needs that are there.
That's correct. Every year, Office of Finance will look at the bond requirements that Unicap kind of puts together, and then we'll do the calculation necessary on the current taxable assessment on the property. So that's been a pretty straightforward process based on the parcels that have been identified in that district, or I guess cohabitating districts, because we have the TIF component and then the special taxing district. We've never had to do a special tax for these properties. The increment financing has already been handled through the assessment increases over the years.
Okay, thank you. Mr. Smith?
I was just going to say, I talked to the administration about this previously. This property is in District 1. In fact, it really is in my backyard. So I look out my deck and I see the development that's happening in the backyard. The property itself is focused on national security, the things that they're expanded on, and so I would certainly encourage my colleagues to support it because it's part of the national security expansion in that area that they've been planning for a number of years. So NSA and U.S. Cyber Command, this was all a part of that strategy to continue to build out space. And so this property is adjacent to 295. As I mentioned, I literally see it every single day. So I am 100% for it. So just wanted to put that on record. Thank you.
Okay. Are there any other questions or comments? I think we're good. Thank you, guys. Appreciate it.
Thank you very much.
Okay. Next, we will move on to Bill number 2026 and 2126. These are, and 2226. These are all pilot projects, payment in lieu of taxes. Mr. Hunt.
Thank you. Ethan Hunt for the administration. I have Kelly Kenny, our supervising county attorney, and Nori Suter, our chief affordable housing officer from Arundel Community Development Services. So bills 2021 and 2226 are all pilots, payment in lieu of taxes. The first one is for the homes at Shelley, which is an affordable rental housing project for families. That is a proposed 60-unit multifamily project located at 99 Shelley Road in Glen Burnie, and will consist of 2 3-story garden-style walk-up apartments. It'll have a mix of 1, 2, and 3-bedroom units serving 50 households with an income between 30% and 60% area median income, and 10 households without income restrictions. Development team is being led by Homes for America with commercial construction as the general contractor and Habitat America LLC as the management agent. Financing for this project will be provided by 4% LIHTC tax credits, tax exempt bonds, state loan funds, a sponsor loan, and a loan from ACDS. The owner will be responsible for the pilot in exchange for providing housing for low-income households over a 40-year period. Under this proposed pilot, county revenues associated with the property is set at $11,043 for FY27 and includes a 4% annual increase in the amount of the pilot and runs for 40 years or until fiscal year 2067, whichever is later. And we're happy to answer any questions.
Ms. Pickard.
Thank you, Madam Chair. Thank you all for being here today. I just want to remind the council that we also passed legislation that forwarded this project along regarding like parking minimums and some other things. So there's a lot of time and energy and work, and I think the mixed income aspect of this project is a real model for affordability and vibrancy in our communities going forward, and I would encourage more than a 4-3 vote on these pilots. Thank you.
As a question for ACDS, could you, just for the record, for the public to know, what are we looking at when we talk about a 30% income and 60% AMI income?
Is it on? Okay. So it depends on the family size. So, for example, a single person earning 30% of the area median income earns $27,400 per year or less. A single person at 60% earns $54,780 or less. And then that goes up based on the family size. And the units are, a great effort is made by the developers to make sure that the household size suits the unit size. So if it's a single person, they would just get a single bedroom apartment.
Thank you. Ms. Pickard.
I just would like to ask to be added as a co-sponsor to 20, 21, and 22.
Noted, thank you.
All right, keep going, Mr. Hunt.
All right, moving on to the next one. Bill 2126 is a payment in lieu of taxes for Odenton Junction 4, which is a 72-unit new construction multifamily project located at 1457 Hale Street in Odenton. This will consist of an elevator-served building as well as townhouses and will include a mix of 1, 2, and 3 bedroom units for households at or below 30%, 60%, and 80% area median income. It's part of the larger Odenton Junction community, totaling 122 units. Financing for Odenton Junction 4 will utilize 4% LIHTC, DHCD tax-exempt bonds, DHCD rental housing works funds, deferred developer fees, and ACDS loan funds. And the development team consists of Osprey Property Development. The owner will be responsible for the payment in lieu of taxes for the tax in exchange for providing this housing over a 40-year period. Under this agreement, the county revenues associated with the property is set at $9,841 for fiscal year 2027 and includes 4% annual increases in the amount of the pilot. The agreement remains in effect for 40 years after the initial payment or until fiscal year 2067, whichever is later.
And I'm going to let you just jump to the next one, which is also part of Odenton Junction, and you don't have to say it all, just tell us the only difference, I think, is the tax amount, correct? And the number of units?
Correct. So Odenton Junction 9 is a 50-unit community that will have 4-over-1 podium-style elevator-served building and will include 1, 2, and 3 bedroom units with households at or below 30% and 60% of AMI. It's the same developer and will utilize the same funding sources. County revenue associated with this property is set at $8,815 for fiscal year 2027 and again includes 4% annual increases and goes for 40 years or until fiscal year 2067, whichever is later.
Okay. I will say this one in particular, as we've been really trying to promote development of housing around our transportation hubs, and this project is within walking distance of the Odenton MARC station, which will be a great asset for people with jobs that have right there. So, Ms. Schultz, I would like to be added to these 3 as well, please.
All 3?
Yes.
Sorry, thank you.
So, any other questions or comments? I think that does it. Thank you so much.
Okay, thank you.
All right, next is Bill 2326. This is campaign contributions, and Ms. Rodvian, this is your bill.
Thank you. So this is something that I know has had interest in the county for a good amount of time, and it's really, the intent is to improve trust in local government with respect to land use decisions that the council makes. I believe that people will have more confidence in the decisions that we make when they know that legislators are not influenced by donations that they may have received from developers and
the development industry in general. So it's only prospective, so it doesn't impact, I realize we're in the middle of a campaign season, so it doesn't impact donations that would have been received before the effective date of this bill. So it's only moving forward. I believe that there would be strong support from the community just to know that we are fully, even if, and I really do believe my colleagues are making decisions with respect to land use in good faith. But, anything we can do to increase the trust of the community in our decisions, because if even there is an appearance of something, that often is enough to diminish trust. And so this would hopefully increase trust in with respect to land use decisions for our residents and for our county government.
Mr. Hunt, do you have anything to add?
Certainly. Thank you, Madam Chair. Ethan Hunt for the administration. With me, I have Greg Swain, our county attorney. As everyone is aware, the administration is supportive of this legislation. This has been something the county executive has spoken about for many years and something that he ran on. So we're happy to answer any questions, but we support this legislation.
Are there any questions or comments? Ms. Fiedler.
Thank you. How would this work in practice?
So I would, maybe should I let Office of Law, do you have thoughts about this? Or, I can.
Sure.
Yeah, I have thoughts about it, but you might have
Okay,
more practical.
right. Greg Swain, County Attorney. So there's a couple different parts to the bill. Of course, the one part is the last part of it, which is the, I think we call it the
Zoning applications.
mandatory disclosures, right? Which are disclosures, and there's a process that would be implemented through probably the Office of Planning and Zoning and the Department of Inspections and Permits as applications come in. As far as the other provisions of the bill, we looked from a legal aspect. The state has mostly preempted local legislation in this area. So we have enabling legislation for 5 different counties, including Anne Arundel County, for this type. So we know there is a number of counties who already have this in place. Prince George's County, I think Frederick, and I think there are 2 others as well, that provide, and this legislation is modeled after some of those examples. So when you ask, how would this work, I guess it depends on what component of the bill you'd be looking at.
Certainly. So the disclosure process, would that be the responsibility of planning and zoning to review disclosure and then take action if they see a potential violation?
No, the enforcement is not up to Office of Planning and Zoning. That's just part of the application process. So that would be a disclosure filed. And this, but the bill itself, as far as enforcement of the bill, this involves the ethics code. So it would be enforced by the Ethics Commission, and it would be complaint driven, as most of these things are.
And I only have one more question. In the other jurisdictions that have this legislation in place, is it exactly what they have in place? Specifically, I'm looking at the disclosures of basically family, immediate family, parents, siblings, spouse, children. Is that language replicated in other jurisdictions?
I can't say for sure.
Okay.
It's similar.
Okay.
And just when you look at these types of bills, you sort of look at how this all unfolded, and it started in Prince George's County. And Prince George's County was an example because their county council sits as their district council, which actually makes land use decisions. And there was, I think it was back in the 90s, where there was a real explosion, or exposure rather, of corruption, pay-for-play type of influence. And they were the first jurisdiction to actually get the General Assembly. They tried to do it by themselves, and the courts said you don't have the authority to do it. So then they went to the General Assembly, and that's where all of these sort of legislative enactments started with Prince George's County. So those were, I'm sure they're all examples that were used. Prince George's County, Montgomery County has one, Howard County, and then I think Frederick has one. Yeah, Frederick County has one as well. So we can take a look at those and, and advise how they define that familial relationship.
Okay, thank you.
Happy to do that.
But just to follow up, that's my concern is how you enforce that and how we or candidates, anyone would necessarily know the family relationships of their donors. For instance, my siblings, I have no idea who they give money to and who they don't. And so there could be a conflict there that I wouldn't even know about for what they came. And how do we even, how do we even monitor that?
Well, that's why the disclosure part of it is important, because to some degree, you are monitoring it through the donor, right? When the donor makes those applications. So that's really the most significant way you can monitor it. And it's self-reporting, like I said.
All right, thank you. Any further questions, Ms. Fiedler?
I have a follow-up to that. I had the same exact thought. How do we know? And then I don't know about many of the things happening in other parts of the county. And sometimes our office gets notice of community meetings for a development and you're like, oh, didn't know that was coming. So how do we as a council or candidates or how do the elected officials and candidates in this legislation not run afoul if it's difficult to get information on who's involved in what and then their familial relations?
So I think the most obvious circumstance is when someone has made a donation and
Right.
there's an application. And that's certainly a lot of what this is focused on. If there was a complaint and that complaint was investigated, part of that investigation would be the knowledge of the candidate as to what the applicant did and what the applicant was pursuing. So that kind of goes into whether they're finding a violation of it or not.
Okay.
Ms. Ravian?
Thank you, Madam Chair. I also want to respond to that. One of the ways that this conflict can be very easily resolved is simply returning the donation. So I can definitely understand, and in fact, I'm guessing my colleagues have all been recently contacted by a news outlet on this topic, and I was unaware of the affiliations of some of my own donors. I had met them in contexts that didn't have anything to do with their professional life. I met them in social contexts, and so I didn't realize that. And so, I think that is, an easy way to just say, look, I didn't realize what type of business this person was in or their family member was in, and then you return the donation.
All right. No further questions? All right, thank you very much. Moving on, Bill number 2426. This is regarding the moratorium. This is Mr. Volke's bill, but he is not able to be here this morning. So does the administration have anything they would like to say about this? This
Certainly,
bill?
just very briefly, Ethan Hunt for the administration. I have Beth O'Connell, our chief engineer from the Department of Public Works, Lynn Miller from the Office of Planning and Zoning, and Greg Swain, our county attorney. Generally, I don't think we believe this legislation is necessary, but I can turn it over to Mr. Swain to discuss why.
Yes, Greg Swain, County Attorney. As you all know, there was already a declaration of moratorium via an orange notice from the Department of Public Works and also from the Allocation Committee. So one of the issues with the bill, first of all, this has already been done. It's been done administratively. There's no need for it to be done legislatively. Second of all, with legislation, when you declare a moratorium, you're going to have legislation to withdraw the moratorium. So it does make that process a lot more drawn out. And we're all hopeful, we're all looking hard for solutions, and we are hopeful that a solution will come sooner rather than later. Thirdly, I would say there's a couple issues with the bill itself. I mean, I think the section 1 of the bill, which is the operative section, is probably okay. Some of the other parts of the bill are a little too broad because we're really talking about just the Baltimore City service area serviced by the Patapsco sewage pumping station. And the Baltimore City service area also has another area where this moratorium does not attach. So the introductory language is a little too broad as well because it's directed at the entire service area and not just that sort of discrete portion of it. But really, in some, we think this has already been done. It's, as it sits now, it's able to be managed quickly. This bill would really have no legal effect in that. The only legal effect it would have is there would have to be another bill to withdraw it.
Ms. Pickard.
Thank you, Madam Chair. Yeah, on that point, Mr. Swain, my concern about legislating this moratorium is not just having to legislate the undoing of it or the lifting of it, but if over the next few months or year, we're going to be partially lifting a moratorium, how does this legislative action affect whether it's BWI, his opening up some capacity, and does it limit the administration's ability to negotiate partial lifting of the moratorium and or figuring out allocations, swapping, sharing, reevaluating, recalibrating, all the things I'm hoping that are going to happen soon.
That's an excellent point. Because that's the most likely scenario is this is not going to be going from off to on, right? It's probably going to be some subset of that. And then if that happens, and it could happen quickly, the bill we'd have to come back and revisit this moratorium and say, whatever those parameters might be, we're going to have a moratorium over the next, we have 700 EDUs we can work with. The moratorium won't apply to them. It just gets awkward. It's much easier to manage this and much quicker and better for the communities affected to be able to manage it in an administrative way so it can be done quickly rather than in a legislative way, which has its own restraints and its own time limits.
May I ask a follow-up? Thank you. If this bill were to pass, would that mean that the sort of release of additional EDUs that we negotiate with our regional partners, would we have to come back every time and revisit this legislatively?
Yes.
Okay, thank you.
Mr. Smith.
I was going to ask, and thank you, Madam Chair, in 2008, when there was a moratorium, was there a legislative policy put in place when that took effect, or was it just administrative?
It was administrative.
All right, thank you.
Any further questions, comments? All right, thank you very much. We will move on to Bill number 2526, which is supplementary appropriations. Mr. Trumbauer is just going to watch from the peanut gallery?
Not enough seats
Okay. Yeah, okay.
All right, I'll go ahead and introduce the whole team here. Ethan Hunt for the administration. With me, I have Lori Blair Klossmeyer, our Deputy County Attorney, Stephen Terrell, our Assistant Budget Officer, Susan Harold, our Central Services Officer, Nicole Clinton, our Deputy Central Services Officer, Michael Zotto, our Safety and Insurance Manager from the Office of Central Services, Kirk Murray, the President of Anne Arundel County Workforce Development Corporation, Rachel McConaughey, the Director of the Department of Social Services, Alex Backey, the Deputy Director of Highways in the Department of Public Works, and Pam Brown, our Executive Director for the Partnership for Children, Youth, and Families. So this bill is a supplementary budget request appropriation and transfer. It appropriates $10,515,000 from the unappropriated general fund balance and transfers $8,098,900 from the CAO contingency fund for a total of $18,613,900. Of that, the supplemental appropriations, $10 million is going to the self-insurance fund. $515,000 is going to the Workforce Development Corporation, and in the Department of Public Works, Bureau of Highways, you have $1,222,700 going to personnel services, $5,520,400 going to contractual services, and $1,305,800 going for supplies and materials. We also have $50,000 in personnel services for the partnership for children, youth, and families. The appropriation for the self-insurance fund is needed to address outstanding claims and meet the county's fund balance policy limits for the self-insurance fund, and the central services folks will be able to speak to that. The $515,000 in general funds appropriated for the Workforce Development Corporation is due to new federal requirements for the Supplemental Nutrition Assistance, or SNAP, benefits. In order to obtain benefits or retain benefits, residents who are not exempt from the requirements must meet work or activity requirements each month, and this funding will support staffing and operations for the JobWorks Arundel program to assist additional participants to meet the requirements and achieve financial stability. The $8,048,900 appropriation for DPW is for overtime and other personnel costs, contractual services and supplies to cover snow-related expenses for the pretty significant storm we had in late January and early February, and an appropriation of $50,000 is for the Partnership for Children, Youth, and Families to provide 6 months in salary and benefits for an initiative director for the ENOUGH program, which stands for Engaging Neighborhoods, Organizations, Unions, Governments, and Households, which serves Brooklyn Park. This appropriation is in addition to $500,000 in state funding. And we're happy to answer any questions on any of these items.
Ms. Fiedler.
Thank you, Madam Chair. Could we review the self-insurance fund?
My question.
If someone could just speak to that a little in more detail.
So the fund in general is we send projections for the ACFR in October. So based on those projections, the reserves are set and the fund is set. For FY26, we have approved for claims $27,122,000. We are projected in February to be spending about $30,318,000. So for the claims, specifically the workers' comp claims have increased by 7% year over year. Financially, that's in dollars, that equals about a 17% in costs. So there has been a year over year, there continues to be a year over year increase, but there was a larger increase. And so based on our workers' comp claims, and also we had some very large general liability payments this year that equal $2.3 million.
Appreciate that information.
Yes.
Not in that same category. The Bureau of Highways, snow removal. How much of that was related to increased sidewalk snow removal for the county?
I think that's a question for Mr. Backey.
I knew there was an open seat for a reason.
Alex Bakier, Deputy Director, Bureau of Highways with DPW. Thank you for the question. Approximately $500,000 was our cost. We cleared approximately 11 miles of shared use path and about 12 and a half miles of sidewalk as the new code that applies for any property where DPW was the controlling abutting property owner. That was a particularly challenging event when that new bill came into fruition right before the January storm. And that was essentially the first time we exercised that contract. A lot of the work had to be done on time and materials because it was picking through ice and moving boulders and clearing. So the expenses were well beyond what our typical expense would be. We have a tiered payment for the amount of accumulation where the contractor gets tiered payments depending on how much total snowfall. So that would be the high end of what we would expect to ever see. Typically, the cost would be substantially less.
Were the contractors the same, and were they prioritizing roads and then sidewalks, or were they separate contractors working simultaneously on both roads and sidewalks?
The contractors who won the awards for the sidewalk contracts are also contractors that perform snow and ice removal for us on roadways. We necessarily prioritize the roadway work first, and then when we were far enough along in accomplishing those levels of service, then we move them to sidewalks.
Got it. Okay. I'm not surprised with the overtime. That was a terrible, terrible ice storm. I called it driveway glaciers. And I know our teams had to go back out and work on some of those for some of the residents that truly could not get out of their driveways. So I appreciate the answers to the question.
Certainly. Thank you.
To piggyback on that, you said that y'all have tiered like payments based on the how much snow there is. Do y'all have that broken down into accumulation of ice? Because it's two very different things. Clearing 6 inches of snow and 4 inches of ice are really different.
I agree with that statement. As written, I'd have to look at our language again, but the tiers are essentially based on accumulation, numbers of amount of inches of snow accumulation. We have time and materials in there in order to deal with unique circumstances. Mm-hmm. We typically don't face significant ice that would be beyond what our contractor could handle, with some additional de-icing chemical maybe applied as well to address that. So very unique circumstances for what we faced this year. In addition, DPW may receive referrals from inspections and permits if they have sidewalk that's privately maintained that isn't clear. Then we may receive a referral, and having time and materials allows us to then use our contractor to go abate that walkway clearance issue. But that is how we're currently structured.
Okay.
Okay.
Thank you. Ms. Pickard.
Since we're going there with the sidewalk and ice conversation, of those 11 miles of shared use paths and sidewalk, is it safe to assume that that was a lot of our school to community pathways for safe walks to school?
All I can say is that is the segments of walkways that were DPW's responsibility. There are other agencies that have additional pathways that they would care for.
May I? In addition, my other question is more about lessons learned and after action conversations in the executive branch about not just the bill that we passed about snow removal, but also, you know, this year we saw this unique ice storm with snow that created, really wreaked havoc across the county in regards to removal. Last year, it was really low temperatures that kept snow on the ground for a long period of time. We were lucky it wasn't ice, but it also presented a lot of challenges for residents and the county to keep snow removal, you know, the snow stayed on the ground a long time. When do you think we start sort of looking at how we are prepared going forward with climate change and all the effects of those sort of issues on this kind of county responsibility? And then I know from people in the community that do the actual work that, you know, we got a lot of complaints about plows driving through neighborhoods with the plows up because those plows were going to be damaged if they tried to dig into 5 inches of ice. But the residents didn't understand that. So I'm assuming we learned a lot of lessons, but some of the removal that was necessary was not what our regular contractors could perform. So in there's a question somewhere.
Sure, sure.
What have we learned?
Right.
How are we going to move forward and be better prepared with flexibility in our contracting and the kinds of equipment and time and material? And, or is this, are we looking at this as a one-off situation and we're going to hope for the best that we're not here again?
Certainly there are lessons learned. It was somewhat of a one-off event. I've not seen anything like it in 25 years in snow removal operations. The cold temperatures as we had last year and this year, are a challenge. Our typical tools in the toolbox are anti-icing, where we get some de-icing salt material down on the pavement before the accumulation. You always want to get under it if you can. We have our mechanical snow removal with our plow trucks and plow blades. One lesson learned is we didn't have enough steel blades. We use primarily rubber blades in our mainly 214 and above because of the manholes and utilities and other structures that we will hit. We use a blade that's more forgiving. The cold temperatures and ice, those plows didn't work. Salt also essentially is considered non-functional below 15 degrees. You get a little bit of melting. Generally, you need some sun exposure. So most of the week, our salt wasn't working, our plow blades weren't working, and we were well beyond what our initial anti-icing treatments could do. So cold temperatures will always be a challenge for us. We certainly have lessons learned. We made some progress with this council's assistance, increasing our retainer payments. So we had a slightly larger contract force this year than we did last. We will try and again bump that up so that we have additional resources. The earlier that we can remove snow in a storm, the better off we are. The more time there, and we do pretty well on our primaries and secondaries. Our challenges typically will be in the neighborhoods where cars are driving for a period of time with that moisture and cold temperatures and creating a nice layer that has now bonded to the pavement. And to take it one step further, beyond the tools that we have our typical multi-agency program where we up staff to be able to run 24/7. We have our cooperation through with our purchasing agents to acquire contracts for local businesses to provide contract equipment. However, that storm exceeded the capabilities of all those normal preparations, so that in real time we acquired significant heavy contract equipment, loaders, backhoes, etc., so that we could physically remove the the ice and snow mounds from roadways. So that was a somewhat unique and I would say typically one-off situation that we aren't typically prepared for here in our jurisdiction. It can happen. Last time was 2016, where we had to do that during a blizzard, and before that, 09, 010. But it is not. We have that capability. It is just not our typical deployment. Hopefully, that answers your question.
You said that we use like the rubber blades and the steel. Are you able to switch the blades out depending, like if it is big snow and you have to typically have the rubber, can you switch it out for a steel one when there's 4 inches of ice?
You can.
Oh, okay, good.
It takes some time. It's very cold. You've got frozen bolts to undo, so it's not a quick, and you have hundreds of trucks.
Sure.
But yes, so that is something that we did, something that we want to be able to do more quickly and have more of coverage so that we can be a little more effective at that ice pack. But we still face limitations.
Okay, thank you. Ms. Fiedler?
I would just ask if we could have an itemization of this particular section of, overtime versus contract versus.
Yes,
Okay.
and we can and we do,
Okay.
and we can certainly provide that.
Great, thank you.
Right, and I have another one that actually moves on to another part of it. So the supplement for workforce development, you stated that this is primarily because of new requirements for receiving SNAP benefits. So am I correct in saying that we're having to spend $500,000 on paperwork that could be going to feed people?
So good morning. Kirk Murray, President of Anne Arundel Workforce Development Corporation. No, it's not on paperwork. It is to have more case managers and staff to work these individuals that are coming on to make sure that they're still eligible, but more importantly, to help prepare them to get better jobs so they come off the benefits long term.
Okay. I just hate to see administratively that we're just putting money into paperwork when we could be feeding people or doing that, but if we're working toward that. Okay. All right, Ms. Fiedler.
Since we have Ms. Brown here, I would love to hear what the $50,000. I am not opposed whatsoever, but I like to hear your ideas and requests.
Thank you. Good morning, everyone. Pam Brown, Partnership for Children, Youth and Families. This is actually an interesting request. We have been doing a lot of work in Brooklyn Park as part of the Enough initiative, which is a place-based initiative to lift some of our vulnerable neighborhoods out of poverty. And so we had made a large request for dollars from the state, from the Governor's Office for Children, and we got far less than we expected. The money is we wanted all of the dollars, as much as we could, to go to the residents themselves for things like after-school programs, and we've got a great little apprenticeship program up there and a whole set of other things. So because we got less, we didn't want to take any administrative dollars out of it. We could cover half the salary of the person who runs all our Enough initiative, not the other. So we threw ourselves at the mercy of the county and said, could you cover half this salary so that we could give all the dollars to the community as they have got less? And so that's what this request is. It's a request to say, you know, our neighborhood is far too important to us for you not to have all the money. So that's what it's about.
Thank you.
Thank you. All right. Any further questions? All right. Thank y'all all very much. I think we got everybody. Next is done all of those. Bill 2826. This is zoning for commercial districts. This is Mr. Volke's bill, and he is not here, but Mr. Hunt, does the administration want to?
Certainly. Just very briefly, Ethan Hunt for the administration. I have Kelly Kenny, our supervising county attorney, and Lynn Miller, our assistant planning and zoning officer. We are comfortable with this legislation. It's a minor text amendment to allow apartments as an accessory use in C4 commercial districts.
Okay. Are there any questions or comments from anyone? All right, that's all. Okay, and then we'll move on to bill number 2926, which is another zoning issue about licensed dispensaries of cannabis. This is also Mr. Volke. Mr. Hunt.
Thank you. Same crew at the table. Myself, Kelly Kenny from the Office of Law, and Lynn Miller, our assistant planning and zoning officer. So I will be reaching out to the sponsor after today's work session to find a time to meet with him to talk about this. So we are opposed to this legislation, and there are three basic reasons why. The first is there's a legal preemption issue. So the Maryland Cannabis Reform Act created a specific window of time for local jurisdictions to enact more restrictive distance requirements from other dispensaries, and that window closed on July 1st, 2025. So requiring a half-mile separation requirement now, we're acting outside of the state authority. So it would basically be unenforceable. The second is that the legislation creates a de facto prohibition, because when you layer the 100-foot setback for a residential buffer on top of existing state mandate buffers, you're creating kind of a geographic lockout within the county. And it really limits the areas where you could have dispensaries. And then the final issue is a policy issues. So the specific proposed dispensary that I know this is attempting to address is a state-supported social equity operator. So moving forward with restrictions would place the county in conflict with the state's mission to support historically disadvantaged entrepreneurs, which adds another layer of legal risk that we believe is unnecessary. So.
Any questions or comments on that? All right. Is there any other business any council member would like to bring before the county council at this time? Ms. Schultz, is there something I need to read or do?
You do not need to do anything, but I do. We do have a resolution to introduce today that will have a hearing on April 20th on Monday evening. So let me just.
That does need to be announced today.
Yes. Resolution 826, resolution approving conditional appropriation of an unappropriated grant to the Grants Special Revenue Fund, Maryland Department of Transportation, Maryland Transit Administration, electric hybrid buses, $900,551.
Okay. All right, thank you.
And I just want to know it'll be on our website shortly.
Okay. May I have a motion to adjourn? All in favor?
Aye.
Opposed? Motion carries. County Council is adjourned until Monday, April 20th, 2026 at 7 p.m. for our next legislative session in these chambers. There we go.